All right, guys, I think we'll go ahead and get started so that we can stay on time. I want to be respectful for your time today on Saturday and can't express our gratitude for y'all being here. I'm going to leave this up so I can see everybody because it's kind of cool. I make these first announcements. But again, I just want to welcome you all for being here, taking the time and the commitment on a Saturday from so many. How we make changes, improvements, we reduce our out-of-pocket costs, we lower healthcare, we solve solutions to access barriers to care and treatment first begins with all of us coming together and having a seat at the same table. And I can't express with enough gratitude what we have here in South Carolina and for all of you for having a hand in everything we do within our advocacy and our coalition work. So on that note, I'm going to be moderating the meeting tonight and providing our coalition update very quickly because we have such a fabulous program. We are recording so that we can use it for training and going into the following year. And unfortunately, Jeremy and Crystal cannot be with us today, so you guys are stuck with me. I want to just thank all of our coalition stakeholders for being with us today. Our state agency representatives, our healthcare providers, our national organizations, our ambassadors, now 55 members strong. Thank you. A shout out to our new members, Dana Gurley, Samantha Javorka, Ursula Sagat, and Kristen Shelton with us today. And if I've missed anybody, any of our newer members, just go ahead and put your name in the chat if you'd like to, so that we'll welcome you here today. I think we have a lot to go through, so if it's okay with you all, we'll just put our questions into our chat. If you have something while someone's speaking, or just write it down, and then afterwards we'll stop at each session and we'll let everybody answer some questions. And just remember, no question is a dumb question. Feel free to ask if you don't understand the subject matter. Because we do have a tight meeting, we may not be able to go into depth for that question, but we'll definitely come back and answer them later, or we can stay on after. I don't have anything going on, so I'm welcome to stay on afterwards and answer any questions anybody has, but I do want to be respectful for everybody's Saturday. I'd like to thank all of our advocacy sponsors for all they do to support our program, helping us become a strong advocacy organization. So shout out to Novo Nordisk, Genentech, Bayer, Takeda, Santa Fe Genzyme, CSL Behring, the Hemophilia Alliance, Pharma, the National Hemophilia Foundation, and Hemophilia Federation of America. Thank you for allowing us to have a voice and let our voices be heard. So before I get started on my presentation, which I said I'm going to go through very quickly, I would like to start with our president, Shelley Crisp, who has been with the coalition from its inception. We all got together in the very beginning there was Shelley and also Wendy and many others, but I want to give a shout out to our new president, Shelley, all she has done and supporting the coalition work and the chapter's work, and let her speak a little bit about why she does what she does and why it's important for all of you to continue to be here and doing what we all do together. And our vice president, also Aaron Smith, who also has been with the coalition for a long time, wants to say a few words. So I'm going to go ahead and Greg, can you spotlight them and we'll let them get started. So welcome, Shelley.
Hi, everybody. I am Shelley Crisp. I am from Moncks Corner, South Carolina. I have an 8-year-old spontaneous hemophilia A, severe. He is living the best life ever right now. I mainly started this journey with the chapter because I wanted to learn more and I wanted to know other families that have gone through what we have. And I will tell you, in the past 2 years, it's been one of the best things I could have had happen. We started out like everybody else, getting prophylactic medicine. Everything was great, no problem, it's fine. Probably a month ago, I got a call from one of our doctors stating that the insurance company that we've been with the whole entire time Lucas has had this medication decided that they didn't like how we were doing it. They wanted us to change, I will say, the dosage that he receives for cost management, I'm going to say. They didn't use those words necessarily, but they wanted us to increase Lucas's amount of shots that he was getting as opposed to staying on what the doctor prescribed for their benefit. So I was able to work with my doctors. I was able to work with, Hemophilia South Carolina, the Bleeding Disorder Association of South Carolina. I was able to, luckily we had family camp. I was able to reach out to our provider of the medication and ask them questions. I was able to ask Sue. I was able to ask other people that were on the same medication if this happened to them also. If I didn't have the chapter and I didn't have the support and the advocacy that we have now, I probably would not have been able to fight it as hard as we were able to. Luckily enough, I have amazing doctors who were there and on our side. They were able to talk with our insurance company and say, you know, this is how it needs to be done for his mental and physical needs. You know, there's no need for an insurance company to say, hey, this is how you have to do something. And honestly, if we're not advocating for our patient rights, then it's going to change, because they're like, they don't care. They'll just do whatever we say, and we can't have that. So that's one of the reasons, just one, but there's plenty more of why I think that the advocacy and the chapter is very important. That's my spiel. So keep on doing what we're doing.
Oh man, perfectly said, Shelley. Thank you so much. Absolutely perfectly said. Thanks for sharing that and staying in touch so that we'll make sure that we solve that problem if that comes down the pike a little bit more. So let's hear from Aaron. Aaron Smith, where are you? Welcome. Good morning, Aaron.
Morning, everyone. Aaron Smith. I live in Columbia, South Carolina with my wife and 2 sons. My youngest son is 4 years old. He was diagnosed with severe hemophilia A when he was 9 months or so. And we had no family history or anything, so everything was just a surprise. I got involved with the chapter first thing. Shout out to Bleeding Disorders South Carolina being the best chapter in the country. They had great educational material. I went from 0 to 100 so fast, and I'm so thankful for that. Along with all that education, the Advocacy Coalition opportunity came up. I jumped on like with everything else, and the material and the training and the education is really just so powerful. It's empowered me to be a better public speaker. It's empowered me to make connections with legislature at the county level, at the local level, county, state, and even at the federal level, at the federal government. So it's been a great journey. And they make it really easy for you. There's email campaigns, everything's already kind of even said for you. And then you can kind of just build that relationship with your representatives. And the coalition gives you all those tools right at your fingertips. It's so easy, and it works. That's the main thing. It really, really works. I was skeptical at first, but my local representative, we had some meetings at the State House, and you only get to see him for a very short time. The first year, I saw him for about 45 seconds. I said a couple of words. He had a phone in his hand. He took a picture, put the phone behind his back, and he said, "I will follow up with you." And I was like, "Yeah, sure, whatever." The next year, he couldn't come to the meeting at his office, but invited me down to the rotunda and came out in between votes. We had about a 15-20 minute conversation total, and was really powerful stuff. And then I asked him to support our bill, which he ended up supporting our bill. Later on, he moved in beside me, and I didn't know it was him. And he said, "You're that guy from Hemophilia, South Carolina." I was like, how did you know that? You know, so I know that's their job to connect with people, but people do recognize, you know, if we wear red ties at the State House, they know what that is now. And it's a powerful thing to be a part of a coalition that actually gets things done. And I look forward to helping others become comfortable and continue the work that the coalition does.
Perfect. Perfectly said. Thank you, Aaron. You are a great advocate. All of you are great advocates. You know, when I hear these stories, I get very moved, just because I do believe so strongly in making sure that your voices are heard. And when we have access to care and you have the right care, the right treatment, bleeding disorders, I'm not going to say it's not easy, but bleeding disorders are such more easier to work with. So I'm going to just give my report really quickly, like I said, because we've got so much going on. I will be respectful to everybody. But you've already heard some of our ambassadors and the new ones on there. I hope that you understood that we're welcoming for you. It's easy peasy and you can do all this. So thank you again for being with us. I'm going to give you just a little of our coalition wrap up. We're going to talk about our core values and our strategic plan, how we build that. You're going to hear from the Hemophilia Assistance Program. You're going to hear about our treatment centers, from our treatment centers and those that support our treatment centers. We're going to talk about our 2022 legislative outlook. What does that look like? How do you work within a state, a very Republican state? So I'm really excited to hear about that. And then you're going to hear from our national organizations, what's happening, what's the trends. What happens at the national level comes down to the state level. So that's why we are one partner all together all the time. So how do we plan? How do we work on our strategic plan that we do in our advocacy organization? Every 3 years, we build our strategic plan out, we review it, we look at it. And these are just these are 7 big priorities, but then we have several different objectives in there. And just briefly, I thought I would throw a couple up here. I will also be happy to share my slides later after the meeting. But, building partnerships and relationships at the agency level within our state, within the legislative level, is everything to helping people come together, understand. And, education always opens doors. And we know that if you're not educating people, sometimes they just don't know. They don't have the knowledge of living with a bleeding disorder. Continuing to do our advocacy work, expanding it, building grassroots capacity throughout the year is very important. Identifying access to issues. So here's a funny thing. So I found out, and the first thing I did in the morning was I emailed our treatment center and I said, oh my gosh, this is a problem. We have Prisma Healthcare is a huge organization. I mean, huge healthcare in South Carolina. United Healthcare is another huge healthcare provider, and they couldn't come to an agreement for quite some time. Luckily, they did. So my goal after my meeting next week at Nationals in San Diego is to come home and address the problem that this is just not going to work if United Healthcare and patients that are on that, we're going to be out of network for seeing our HTCs. That just was not going to be something that would be pretty. So identifying issues that at the grassroots level really affect our patients and our community is key. Nurturing and growing our partnership with all of our allied healthcare organizations. We continue to do that. I'm continuing to look for other organizations that have like-minded issues that we can all partner with. We know that we're stronger together than we are separate. We've learned that from our national organizations and all of everybody that has given us the leadership role of becoming who we are today. I just can't thank you enough for all your guidance in helping us to understand if we're all on the same page and working together, we can do anything, really, to be honest with you. We're going to continue to have strong communications with our patients and our stakeholders and all of you, our members. And fundraising for all of these advocacy issues is an important avenue. We want to make sure that if we have a call to action, that we have funds in our line item budget for all of the advocacy work that we do. So part of our fundraising efforts each year go to our advocacy initiatives. So this is my little brag sheet. I just love this, and you're going to see it all the time because I'm always updating it. This is just excuse me. We have 46 counties, all 7 congressional districts. So when we go to Washington and with our national organizations, we strategically plan on getting a member that's in each one of these districts. So now we've got somebody and we try to bring them to Washington so we can have 7 meetings with all of our representatives. And my goal is to have in every single one of these counties to have a representative like many of you here today. We do have Newberry covered, so I'm going to have that slide updated. But right now we have 55 members that have said that they are on our side. They're with us. They may not always be with us at every advocacy meeting that we have, but we can call upon them at any time and they are ready to go. So thank you all for that. So these are just a couple of our success stories for 2021 and some of our goal priorities going into 2022. These can always change, at a moment's notice if something comes up. But we are very excited that we were part of an instrumental push to get the Rare Disease Council bill through the House. It's now assigned to the Senate Medical Affairs, I think, subcommittee. It is a proviso in the MUSC budget. They took it on and housed it. That has been confirmed. They have now did their assignments. They had a quick meeting with all of their new people, and they are going to be gathering in the 1st of January, and they will have open public meetings. I wish we could have been a part of some of those conversations, but we were not. But we're excited that I strongly believe that they've got what they need, and they're going to do good work within the RDAC. I did reach out to, it's being led by Dr. David Zess. He's the CEO and the Chief Clinical Officer at MUSC's Health Division. And Dr. Patrick Flume, who is an endowment chair for MUSC's Cystic Fibrosis Endowment Program. I did reach out to them both jointly and told them who we were and what we did and that we're here and I really thank them for taking that on. It was a very hard place to find a house to house that bill or to house that advisory committee. And they did take that on. They took that leadership on. So I'm very grateful to MUSC for doing that and let them know that. I also tell them we're a resource. We're there, whatever they need. They need volunteers. If whatever they need, we're there, and that we're going to be a part of those open public discussions and having our voice heard in that. I did ask them point blank, what about our bill? We're going to be having our advocacy priorities coming up. Do you, now that is a proviso and it's been over at MUSC, do we want to get that as a statute and push that bill through? Asked me if I would send them the copy of the bill, which I did, and that they would send that on to their committee. And that was as far as we got, but I thought that was a good communications back and forth. So I think that good things are going to be coming out of that. Their first thing that they're going to do is get a website. I did tell them if they want all the bleeding disorder, we'd like to be there. And if they need any of the medical bleeding disorder physicians and stuff like that, I definitely can get that, working with our physicians and making sure that people that have a bleeding disorder in South Carolina, and if they are newly diagnosed, that they will get to the right people. So I'm excited about that. From our forums, we've had forums in 2018, 2019, and then of course COVID hit, and we've had our strategic planning, and we've had our meetings like these, our year-end meetings. And from that, and from all of our conversations, great things have happened, and I'm so proud of where we've come and the work that we've all done collectively. And you're going to hear from Prisma Health, from Dr. Ambrose and Shayla, and the things that are coming down the pike for our HTCs. I'm so very, very proud of that. We have no significant changes here in the Medicaid. You're going to hear about that, of drugs being put on a PDL list. I'm not going to say a lot about that. You're going to hear that from Nathan. So having that great relationship with Medicaid, we're going to continue on that, because we do believe patient care should be provided by the doctors and what they think is best for the patient. We don't want to be putting our drugs onto a PDL list and not being able to get them, even in the Medicaid benefits. I'm very proud of the fact that we have a strong advocacy coalition. We have 12 monthly meetings. We have an advocacy newsletter. We have Greg, who's doing great videos and marketing for us. We did training for 394 individuals throughout last year. Some of those are, it's the same individuals, but we did have 394 individuals receive our training and information. We have 4 quarterly advocacy meetings such as this. This is our 4th quarter meeting. We did 5 webinars and meetings. And we have a phone to action, thank goodness, from NHF that allowed us to touch a lot of legislators. We've got that going on now. We're really excited about that. I was getting ready to do one just for the Prisma issue, but thank goodness we don't have to do that. So we're ready at a moment's action. And that's what's important for us and for our community. And again, with 55 members strong. We will, in our priorities, we will continue to align with NHF and HFA on all the policies that we all agree is helpful for all of us. We did sign on to the Help Copays Act, the HR 5801. I won't talk a lot about that. I'll let them talk about that with the accumulator adjuster. So I'm excited. If we can get that done legislatively, then we can relax on the state level. We're going to be part of the conversations for the RDAC, like I said, seeing if we need to move that from a proviso to a statute. We are in, I'm super excited about this. We are in the formation of the state's first patient advocacy coalition for chronic and rare disorders. And maybe we'll call that the South Carolina Patient Advocacy Alliance. That is a really important piece that we need in South Carolina. You'll see in my next slide in our SWOT analysis that was one of our weaknesses. So I won't talk a lot about that, but boy, I'm going to be pushing for that, because I think, again, the stronger we can be together with other organizations that we have like-minded issues that affect both of our disease states, we can make a lot of movement. Our Hemophilia Assistance program, we're still gonna, that is a great program. You're gonna hear about that from Anna in just a few minutes. I'd love to see if we can expand that, if there's more funds that we can get to that, because I do know, and I don't know that they need the funding at the moment. We'll find out, and any kind of exceptions that might be needed to make sure that those people that are in South Carolina that have absolutely nowhere to go for insurance, that they have insurance and they have the healthcare they need. Our HTC expansions, we're growing. This is great. And what I'd like to see is an increase in our adult utilization of our HTCs. I am a firm believer of the HTC experience and the comprehensive care model plan of treatment. And I'd like to see every one of our adults in South Carolina utilizing that care and still having their other doctors as well. But we've got to figure out what would make that happen. And that's not just South Carolina, it's all over. But I think I just know that there's lots of calls that come in and I'm like, you're not getting what you need. So we need to fix that. Mental health care and health equity, we're going to be looking at that, making sure that we're addressing that. We've got a new website coming out with a whole page on mental health, healthcare. So I'm excited for that. If they log in and they need some help, they can get it right off our front page and it'll go right to another page. Looking at health equity, making sure that those most vulnerable patients and those in the rural areas and stuff can utilize healthcare. We need to address that. We'll explore women's health and health equity and outreach and help our women who are still not getting the right treatment care that they need. And then I would love to see a standard of care someday again for our specialty pharmacies that are working in the state, making sure that everybody's on the same page of what's the best delivery models so that there is never any issues. And of course, patient emergency room care. If we can get standards, that would be great. These are just, like I said, some of our wish lists, but we'll always address them as we go on. This I'm not going to go over a lot. This is just our SWOT analysis. This is, like I said, this is where we start looking at what are our strengths, our weaknesses, what are our opportunities and threats. And here's where I said, a couple of years ago, we do not have a statewide patient advocacy coalition that needs to be formed. That's a weakness. And I do really believe that that's a weakness. So guess what? Here we are. So these are what we really look forward to. And so my last slide just talked about where we're going, looking ahead. We are going to have our legislative days. We're planning it for March 8th and March 9th. It'll be either hybrid or hybrid and virtual and in person. I'm waiting for somebody to let me know if they're having in-person meetings. Of course, we'd love to do that and do like we do, but we can also have hybrid meetings at the same time because we do know we reach a broader source of individuals and reaching out further in our state if we can do that in a virtual setting. We had a lot of people that can't maybe take off work, but they could Zoom in really quickly for a meeting. So that was really exciting to learn how to do that. And we did really well with that with last year's meetings. We'll have our training on May 8th, and then we'll do our meetings on the 9th, and then throughout the month, just depending on how we do our legislative days. Please do make sure that you save March 8th and 9th. It's the week after NHF's meeting. So we're going to go to Washington, then we're going to go home. We're going to go to our state capital. So it's a good time, all in Bleeding Disorder Awareness Month, to raise a lot of awareness for what we've going on. Our phone to action plan, we'll still use that now that we've got that going. And if you're not a part of that, we'll make sure that you are hooked on. Our digital platforms, like I said, we've got Greg, who's doing a great job on all of our digital work and our marketing. We are going to be expanding our VIP program. If those of you that don't know what we have, I think we're the only chapter in the nation that has a virtual, we designed a virtual innovation program. We have 85 iPads that are out to our members. They're in their hands, and we put blueprints onto them, and we send information out all the time. We are going to make an advocacy blueprint, and I'm really excited about that. So what that means is I can wipe everybody's iPad clean, and then I can put on links and stuff so that they'll get this. In fact, I'm going to put this meeting onto their iPad and say, hey, this is our wrap up, and make sure that you look at it on your own time. And the tool for this is fabulous, being able to manage everybody's iPad and have a direct link right to them. I could text them and say, hey, turn on your iPad. There's an announcement you need to look at right now. They can log up their iPad and they turn that on. So we have more fun with this virtual program, and I'd love to see an iPad in every single individual's hands. Legislative priorities, again, we're going to be doing education on bleeding disorders like we always do, but here's the big kicker. We really need patient stories. What is causing you concern or access concerns? When we hear them, like Shelley had expressed, we are ready to get going. And that may be something that we're going to be looking at. But if there's a concern that's causing you not to be able to provide the right adequate care for your loved one or yourself, that's an issue for us. And we need to make sure that we can fix that. We're going to support our Hemophilia Assistance program, like I said. Any other bills, obviously, if we can get the Accumulator adjuster bill fixed in the federal level, then we don't have to do anything at the state level. And then, of course, we're going to support our rare disease. And again, as I said, we want to make sure that health equity is good. I want to make sure that every adult patient has the same care that the pediatric patients have with their doctors. We have fabulous doctors, and everybody knows pediatric doctors are wonderful, and they do see our adult patients, but we still have this this divide of how to get those patients to the HTC and into that comprehensive care treatment model. So we're going to be really pushing some, maybe we've got to change our language. We've got to look at how we can get them, our adults, hooked into the HTC experience. And then advocating for our women with bleeding disorders, giving them some health equity. Maybe we need a standard of care for women that's equal to men. Our women carriers of genetic bleeding disorders, our symptomatic carriers, and our underdiagnosed need to be identified. The undiagnosed need to be identified. They need to be heard, and symptomatic carriers need to be heard. And then we need to provide treatment care. I cannot tell you how many times people will tell me something that's going on. I'll ask them what their levels are. And in my mind, I'm like, oh my gosh, you're bleeding, and that's why you're not healing. We got to fix that and get that equal to what our men have. So that's the last of my slides. I'm going to take down my PowerPoint. Thank you all. I'll open up to any questions that you might have. But again, if we can work together, we can accomplish everything. This little girl just, she's one of those, if we can do it together, we can do anything. So thank you for listening, and thank you for being a part of our program. Really, really appreciate you all. So does anybody have any questions before I open up to welcome Anna Bleasdale from the Department of Health?
Sorry, Anna.
Go ahead.
Yeah, I was wondering because they had called me the other day and it was telling me that United wasn't taking Prisma Health anymore, and it really scared me the other day. I was really scared because my kidney doctors, that's where they at, and all of them every day. And I said, well, I got to turn around and find me another doctor. But I'm glad actually you said it didn't sign the contract. So I'm really, really relieved right now.
Yeah, thank you for sharing that, because that is what we do, is make sure that all of our voices are heard. And again, if we didn't get anything done here, I'd be talking to the HTCs, I'd be talking to our national levels, and that's why being spot on really helps, because that would have been a big issue for us. So that's a no-brainer. We don't have to worry about that.
That was scary. That was scary the other day, Sue. I started to call you the other day. I was so scared.
I know. I know. I was waiting. We were going to be on a roll right after our meeting. So, all right. So let's go ahead and get started back on our track. Thank you again, all, for all you do, and thank you for being part of our team, which makes us all strong together. So I'd like to introduce y'all to Anna Bleasdale. She is the new director for the Department of Health that runs our program at the DHEC program. And Anna, you look beautiful, and thank you so much for being here. And I'm so glad. I'm sad that Tammy left, but I'm so glad when she said you were her replacement. I was like, a whole big, it just dropped off me that we know that we'll be in good hands. So welcome.
Thank you. Thank you. I know the one good thing is I've been working with hemophilia since 2016. So many of you already know I worked as the nurse coordinator and nurse consultant prior to this position. So I do have experience, but I don't have a lot of updates regarding DHEC, but we are excited that we are entering our 5th year of premium assistance. Every year this program has grown. It is a great program, and we are very proud of it. It can continue to grow, Sue. I'm very well aware of that, but we're very proud that we are continuing our partnership, and we are able to provide this premium assistance to clients with hemophilia and von Willebrand's who are uninsured. That opportunity is still available. So if you know anyone who is uninsured, who has von Willebrand's or hemophilia, please refer them to our office, and we will go over the eligibility requirements. We will go over the program. It's a very quick and easy application. It's not difficult. It's really some consents and some background information and some financial information. And then we can refer you to our partner and really get you the care and the services that you need. And we actually cover the premiums and any of the copays related to your hemophilia or von Willebrand's diagnosis. So it's a really great program. And I did want to note, Sue, you're probably aware of this, but open enrollment has been extended through January 15th this year. So we have a little bit of a grace period. If you want your insurance to go into effect by January 1st, you do have to be enrolled by that December 15th date, but there is a grace period. So it is open through January 15th. And I think that's really all I have, Sue. So I'm very short today.
Was there anything that, and I know that, so one of my struggles is when I get somebody and I say, hey, we can get you insurance. I've got to get you connected. And sometimes that connection doesn't go, and these are some of those issues that we have with people that may not have internet. They may not have the capability to get paper signed back and forth. What is your strongest barrier that you see in sometimes when we don't get those people to you, when we know there's help and we know they're still out there? That breaks my heart. Anything that we can do to help with that?
So one thing, if you can really and truly, if you can get them just to contact me and let me get that initial information, I have staff in all of the regions across the state. So if there is an issue as far as internet access or mailing or whatever, I have staff that I can say, hey, I need you to do this by this date, and they can meet the client where they're at, meet the patient, and really help speed this process up. We actually offer this program for sickle cell as well. And so, we have other avenues. If we can just get the clients to contact us, I can arrange to really, and we've done it before. We've had one of our nurses meet someone at a health department that's close to them and get everything signed, get what we need. And then it has progressed. That time it worked. So I do have those avenues available if we can just get that initial contact made.
That's awesome. Because we were thinking like, oh, I got to hire someone just to do that small part. So if you have the staff, we're good to go.
I have the region staff. I do have the staff.
Awesome. All right. Well, we'll be meeting after the first of the year just to double check. And again, welcome for being here and welcome. And thank you for all that you do for our patients. South Carolina is very, very privileged in that way. And I'm very happy for them that they've got that care and such caring individuals that I know that you guys are that work with them. So thank you.
Thank you. Thank you, Sue. I appreciate it.
All right, so next up, anybody have any questions for Anna? Did I see something in the chat? I'll check to that later. All right, so how about we slip into the treatment center? As I said, what's so important for us all is to have that comprehensive care and getting people there. So I'm really excited that we have Jeff Blake. He's the Senior Vice President of Payer Relations in the Hemophilia Alliance. He has a wealth of knowledge. Works with NHF, HFA, and everybody at the Alliance. So Jeff, we'd love to hear what's happening in keeping our HTCs that, I just love funded and what any things that we can do to help at the chapter level. So thank you for being here and welcome to Jeff.
Thank you. Good morning, everyone. Thank you for inviting me today to the session. I trying to get this into
that little button, that little thing at the bottom down there, that one, now to the right, keep going to the right. The next, the next, yeah, that one, push that one.
That one.
Yep, sometimes you have to do that a couple of times.
Yep.
Okay.
Well, appreciate it. Appreciate your time today. And I just want to thank you for inviting me today and the Hemophilia Alliance. A couple of years ago, I was able to attend in person when you had the meeting in in your home state there. So appreciate it. So now if I can just get the slides to go.
I think,
there you go.
There you go.
I got it. My screen, I was getting worried. So this is just a little bit about me. Wanted to share that I am the Senior Vice President of Payer Relations. I've been with the Hemophilia Alliance since 2016, and our organization has been in place since 1999. So we've been around for quite some time. I'm not going to go through this slide, but just like you all, your family and the support you receive as family from different organizations is critical. So I've shared a picture of my family at our youngest daughter's recent wedding. And now I'm free of paying for weddings and can enjoy saving for retirement. So Just to give you additional background about myself, before I joined the Hemophilia Alliance in 2016, I worked 8 years at the Indiana Hemophilia Treatment Center. So I've been in the bleeding disorder space for about 13 years now. So, and have loved every minute of it. Real quickly, the Hemophilia Alliance mission, we are a national network of member hemophilia treatment centers, and our goal is to make sure that our hemophilia treatment centers have the expertise, resources, public support to sustain their integrated clinical and pharmacy services for individuals with bleeding and clotting disorders. And I think this ties real nicely into our hemophilia community as a whole, because as Sue mentioned, you're doing everything you can to grow your hemophilia treatment center network and support the patients. And our goal is to also help in that effort. So a few months ago, or a couple months ago, we had this article about the integrated hemophilia patient care via our national network. And this was a published article that included many folks around the hemophilia community from the various organizations. Dr. Valentino at NHF really led the charge. It had HTC clinicians. The Hemophilia Alliance was included in that publication, and here is the link for that publication. But what's really great about this publication is it's an updated story that individuals can use in their states or nationally about the value of the model of care that we receive at hemophilia treatment centers. And if you think about some of the journals and articles about our hemophilia treatment centers and the value of care, they were starting to get a little dust on them or age a little. In the 90s, we had the Susie article, and now we've got this article here that really shows the support. And I think it's great that it involved NHF, it involved the hemophilia treatment centers, it involved the Hemophilia Alliance. So it really tied all the organizations and community together. What are we doing as an organization? Well, we're in support of the NHF Unite Walk Wall of Walkers. We continue to promote policies in support of the hemophilia patients in the community. We've been very involved with the Protect 340B Act, and I don't have enough time to go into the details of that act, but for hemophilia treatment centers to sustain their business model in their clinics, they really need to have the 340B drug discount program. And so we've been working on this with protecting the 340B, and in general, that Protect 340B is really trying to make payers and insurance companies look at 340B drug discount program no differently than they do a commercial specialty pharmacy. And so if this legislation passes, which we're hopeful, over time it will, that'll provide some additional protections to our 340B program. We've been working with the Hemophilia Federation of America on just focusing on programs that will continue to support the hemophilia treatment centers and the care they provide to patients, and just aligning ourselves with HFA on all the other policy items, including the protection of 340B programs. So it was really comforting to see, your 2021 goals and accomplishments and what you're planning on 2022, because I think it ties nicely into what our policy agenda is today and moving forward into 2022. We're always monitoring the 340B drug discount program and policies and issues around that. And what's been really nice is as these issues have come up, we've been able to reply to them, not just as the Hemophilia Alliance and our hemophilia treatment centers, but we've been able to respond to these policies and issues as a community as a whole, the patient organizations and the treatment centers. We continue to monitor operational issues. And some of those operational issues can just be tie into the access for care, so we're looking at ways to minimize and eliminate the carve-outs where hemophilia treatment centers and their pharmacy programs are not an option to dispense to the patients at their center. And we're monitoring discriminatory reimbursement issues, and that's really ties back to that Protect 340B Act. Some of the discriminatory issues is United Healthcare, for example, will pay a commercial specialty pharmacy more than they will pay a 340B pharmacy, a treatment center pharmacy, for dispensing. So what they're doing is trying to take away part of that 340B drug discount program. And so that's not only occurring in hemophilia, that's occurring in all 340B drug discount space. So it's affecting disproportionate share hospitals, the health centers, and et cetera. So any covered entities dealing with that. We're always working to create access to care for hemophilia treatment centers and their patients. So we're working with CMS nationally on Medicaid stuff and Medicare stuff. We stay in tune with the Affordable Care Act and what's occurring. We stay in tune with other issues that pop up, the copay accumulator issues. We work with the advocacy organizations on that. In the Medicare and drug pricing space, we're looking at what's occurring in Medicare Part B related to drug policies. So all of the bleeding disorder products today are covered for Medicare, are covered under Medicare Part B. And so it's critical to make sure that we have those drugs covered in the policies and not appropriate reimbursement for those drugs. We've been involved on the implementation of the Skilled Nursing Facility Access Act. It's wonderful that our community was able to get that act passed. It's law now, but now we've got to get it implemented. And so we're working with NHF and the Healthcare Association, that is the association with skilled nursing facilities, to educate them on what our bleeding disorder patients look like and their needs for skilled nursing facilities, so we can get the skilled nursing facilities comfortable to accept our patients now that there's a separate reimbursement for the medication. And so we're working on that in tune with other organizations. And we're just really always monitoring the drug pricing. That's been front and center, that drugs are too expensive and we need to solve that issue. So we've been working with Congress and responding to their ideas and thoughts about how to solve some of that issue. Here's just some additional information about the Protect 340B Act. And I think the biggest issue is it's the second bullet point, and that is it's trying to eliminate the discriminatory pricing between 340B entities and other pharmacy programs. If we can get that into legislation, I think that really helps our hemophilia treatment centers. We're also trying to get language added that says networks can't intentionally exclude hemophilia treatment centers and their pharmacy programs from contracting. We're not sure if that will, stay in, if someone will add that language or not, but that's our goal, is not only to eliminate discriminatory pricing, but allow or kind of twist the arms of the payers to continue contracting, not only for the medical services, but for the pharmacy services. So this is just another slide about that. And I brought it up earlier that you cannot treat a 340B provider and their contract pharmacy. So it's not just an in-house pharmacy, but it's any contract pharmacy relationship that the 340B provider has. And they have to be similarly situated. So it's really good from that perspective. And so we're real happy that there's proposed legislation out there for this, and we will continue to work not only with treatment centers, but the community as a whole on trying to make this actual legislation. This has been a big effort of our organization and a couple other organizations, but in August of 2020, STEMAID was recalled worldwide, and our organization has really led the charge, with other organizations, and we found this 503B compound manufacturer pharmacy called Stack Pharma, and they're a manufacturer, and they are now producing DDAVP intranasal spray as a substitute for STEMAID. They've because this is a pharma organization and a new product, we have to go through a lot of state board of pharmacy rules. South Carolina's board of pharmacy has not approved Stack Pharma as a manufacturer or the product yet. And I was going to encourage your organization to continue to push the Board of Pharmacy, hearing from the patients and the advocacy organization about the importance of this drug. And it's not only important to have access to this medication, but in general, it has the potential to lower the total cost of care, because if someone could get this product, it may avoid an emergency room visit. It may avoid the use of using a clotting factor medication. And we've heard stories where patients that could not get access to this product have had to go to the emergency room, as well as have clotting factor infused. So this is a big push. The first vials were shipped in September, and we're almost out of those. The second batch has been produced, and it's going through final quality assurance checks, and it should be available for distribution by Thanksgiving. And the first ship vials produced only had a 60-day expiration date. The second batch will have a 6-month expiration date. So if we can get South Carolina Board of Pharmacy to approve this, we could start having Stack shipped to the Hemophilia Treatment Center and the pharmacy programs in South Carolina to support the patients. So this has been an exciting effort, and I think it shows the strength of our community working together to try to solve access, not only access to care issues, but access to products. So we've been really thankful that we could work on this. And in addition to just having the program available, if you recall, there was a STEMAID challenge program where you could, if you hadn't been on STEMAID before, you could get a free trial basically to see if that product was effective. We have a DDAVP challenge program as well. And since it's a new product, even if you tried STEMAID, you can still try this in a trial for free. And that is being funded by the Hemophilia Alliance to get the products out to the patients for that challenge program. just want to talk briefly about how we're working to try to help support the hemophilia treatment centers and the patients related to insurance issues. So in 2017, we created a wholly owned subsidiary of our company called the Hemophilia Alliance Network Services. And this organization is set up to work with payers and hemophilia treatment centers to solve issues. And so what we're communicating out to the payer space is we, as the Hemophilia Alliance and our hemophilia treatment centers, are the experts in care for medical services, and they also have pharmacy programs. And when those programs are integrated together and tied together, it typically leads to higher outcomes, better quality of care at a lower cost. And so we've been working on this initiative since 2017. In addition to assisting HTCs and their institutions in contracting with payers, we have the ability under this organization to actually contract with a payer and then have our member hemophilia treatment centers participate in that contract. We have 5 contracts with payers today in place. I would love to say some of them are assisting the South Carolina Treatment Center and you all as the community, but to date we haven't, we're not there yet for the state of South Carolina, but we are continuing to monitor opportunities throughout the country to do, to bring contracts to the various treatment centers. But in addition to actually bringing contracts, we work with our members to try to solve payer issues. And the key ones with payers, as you know, is the specialty drug carve-outs where you can only get your medication from one specialty pharmacy. That's been one of our key efforts. We are the we're not the sole source of funding to the Hemophilia Alliance Foundation, but we are the major source of funding to the Hemophilia Alliance Foundation. And this organization was created in 2013. It's a nonprofit entity. We provide, the Hemophilia Alliance provides funding for the Hemophilia Alliance Foundation to grant out. The grants are provided to HTCs and chapters across the country. I think what's really great is the board of directors is comprised of a cross section of our bleeding disorders community. So there's some HTC support, there's patient support, there's other organizational support. In 2021 alone, the foundation granted out $800,000 back to the community. For 2022, we're budgeting for this organization another $800,000 in community support. And so it's exciting that as the Hemophilia Alliance has been successful, we've been able to give back to the community. And then from our hemophilia treatment center standpoint, we have the Alliance Pharmacy, and they're a national pharmacy as well as a wholesale distributor. What's really great about this organization, just like the Hemophilia Alliance is a 501c3 not-for-profit, the Alliance Pharmacy is a 501c3 not-for-profit that was founded in 2000. And the efforts that they're putting into the community from a pharmacy, either a contract pharmacy or a wholesale distributor of some of the bleeding disorder products, as they are successful and have revenue that exceeds expenses, they also contribute back to the hemophilia community and the bleeding disorders community. The Alliance Pharmacy also makes contributions and donations to the Hemophilia Alliance Foundation and other organizations. So that's really exciting to have them as a support arm of our community as well. And with that, I want to thank you for your time today and open it up for questions.
Does anybody have questions for Jeff? And Jeff, I just want to say on behalf of all the chapters, thank you for what y'all do and for all your grants and your assistance to the chapters. it's a huge support for us and huge support for our HTC. So we know you guys are always fighting for us. So we thank you for that. And thank you for those wonderful opportunities to partner. Appreciate that.
Well, thank you so much. We're glad we've been successful to do that, because that was a commitment we made when we became a group purchasing organization to give back to the community as we've as we are successful. So it's been wonderful to be able to do that.
And you've kept to your word. So thank you. We definitely appreciate that. Thank you. All right, so we're going to roll right into Stephanie. Speaking of our HTCs, let me bring up her slide. So Stephanie Ambrose is the director of our HTC in South Carolina. So Stephanie, thank you so much for being here. We partner with all our HTCs, and really appreciate you being here and sharing this time with us and giving us a glimpse of 2021 and beyond. So just tell me when you want me to, I can't see you, so if you'll just tell me when you want me to change your slide, I'll be happy to do that. So welcome, Stephanie.
Thanks, Sue. Good morning, everyone. It's really nice to be with you all today. I just wanted to kind of go through and talk a little bit about our year for 2021, and just a little bit of kind of some of our goals and things that we're working on, not just for 2022, but kind of also beyond that. So Sue, if you can advance for me. So where have we been in 2021? Things have definitely been busy. We continue to grow in terms of our numbers, which is fantastic, because I think we've talked previously about how a big mission of ours is to be able to reach as many patients with bleeding disorders in South Carolina, with the goal of maybe one day being able to reach all of them. And so by having some growth within our clinic, I think speaks to the fact that we're starting to get kind of reach out to some of those people that weren't getting care previously. So over the last year, we've had 25 comprehensive HTC clinics with about 150 plus visits. The big part of growth for us is we've had within the last year, between new referrals and new diagnoses of bleeding disorders, we've had 50 or more of those as well. So these clinics are extremely important for our patients and our families, just to be able to bring them the comprehensive care that they need and information that they need to be able to live their best life with a bleeding disorder. And so I'm excited that our numbers have continued to grow and hope that they will continue to do so in the future. Next slide.
Is that the right one? Yeah, okay.
And then a part of that expansion has been the addition of the Prisma Health Upstate. So we were able in 2021 to officially make Prisma Health Upstate a satellite of our HTC clinic in the spirit of being one Prisma. We are super excited, Dr. Gilbert and I both, are excited to be able to provide care to our patients, not only here in Columbia, but also up in Greenville. So I just kind of wanted to highlight her and her entire team up there, and are just really excited kind of for that partnership and relationship, and know that it will bring more care to people in the upstate as well. Next slide. So where do we stand now? That's kind of where we've been over the last year. So just want to talk a little bit about things that we want to strive for and directions that we want to kind of head moving forward. So next slide. So in order to do that, we want to talk a little bit about some of the challenges that we've had. And, it's kind of rings true in all these meetings that we've had. A big issue has just been being able to provide access for all patients with bleeding disorders in South Carolina. We want to be able to bring the best care possible for these patients, get them the comprehensive care that they need. But a big issue has been that we don't honestly know where a lot of these patients are necessarily. And so that's why our collaboration with the chapter is so important because, you know, Sue, they reach out to you oftentimes and you realize that, hey, you know, you're not even getting the care that you need. And so that partnership has been huge. So it's definitely just been a challenge trying to kind of figure out kind of where all these patients are and what's going to be the best avenue to kind of get them to us, especially if they are not, you know, within the immediate vicinity of where we are. We want to be able to provide consistent outpatient care for these patients. So again, you know, what does that look like? We want to be able to get them for at least annual visits. Of course, we also want to be able to see them if they're having any issues along the way, but especially to have at least that annual visit to kind of get established, stay connected. And that way, if anything does come up throughout the year, it makes it a little bit easier to coordinate, even if they're not, like I said, within the immediate vicinity of our facility. So just trying to work more on bringing those patients in. And then something else that's been huge too is trying to optimize inpatient care. So as Sue kind of alluded to a little bit earlier, adult care for hematology is a big issue, not just in South Carolina, but it's really a big issue everywhere. And so we've really had a lack of good adult hematology care within South Carolina. And so we at the HTC here in the Midlands and as well as the Upstate are seeing adult patients with bleeding disorders. Of course, the issue, you know, is trying to get them to us. But then the other thing that also comes up is how do we optimize their inpatient care? You know, both Dr. Gilbert and myself are, you know, certainly pediatric trained. However, you know, being able to see all of these patients on the inpatient side as well has been extremely difficult. So we've got some things kind of in the works that we'll talk about in just a minute, but just something that we've kind of been focusing on as one of the challenges that we're trying to kind of overcome. And then the other thing is just really kind of been space constraints. So, you know, anybody that's been kind of to our HTC and the Upstate has kind of dealt with some of the same things. You know, we are growing and that's fantastic. But with that growth comes, you know, you outgrow the space that you're in. So those are some other things that, you know, within the last year or so, we've really started to kind of realize, okay, we're definitely growing. So let's see what's going to be the best to see if we can expand beyond that, the space that we have. So next slide. So where do we want to go moving forward? So as we discussed, we definitely want to be able to expand the access to care. Our goal over the next year or so is to be able to start up some satellite clinics, which kind of goes back to trying to really figure out where you know, our patients tend to be a little more concentrated so that we can maximize those clinics and that effort as far as trying to think about location for what would be the best. We also want to spread awareness that we're here, and Sue does a fantastic job when patients reach out to her about letting them know where they can get the best and comprehensive care for their bleeding disorder. But we just really want to continue to spread that awareness so that if they haven't even gotten in touch with Sue, you know, how can we let patients, and not just patients, but other providers, because we've seen several patients that will get to community providers who maybe don't feel quite as comfortable with comprehensive bleeding disorder care. But if we can reach those providers and make sure that everyone, you know, is aware that, hey, we're here, this is where we have clinics, we are more than happy to support you. We're more than happy to collaborate and see patients along with you, I think is huge. So we're really kind of working on trying to spread that awareness. The other thing that we're really excited about is in September of this year, Prisma Health here in the Midlands has established their own adult hematology oncology group. It's obviously very new, but their medical director, Michael Houghton, has been fantastic in the beginning stages to work with. He completely recognizes the need that we have for adult hematology care. And he actually does have, from where he came from, he does actually have some bleeding disorder experience. And so he recognizes the great need that our patient population has. And so moving forward, we're trying to work with him and his team to try and see what we can do to bring on some more adult hematologists to help aid in care. So we're really excited about that. We have plans to kind of rethink about redesigning and upgrading clinic space moving forward. And then the other thing that we're constantly also trying to do is broaden our referral network, because we know that our patients with bleeding disorders, yes, they need good hematology care, but there's so many other subspecialties that they need as well. And we really have built up a fairly strong referral network for patients. But we also want to improve their access, because some of these patients we can send referrals, but again, sending that referral doesn't always equivalent to the patient actually being able to go and follow up and do the things that they need. So there's been talk and discussion once we kind of get our kind of ground set with our clinic space about being able to see if we can't bring access to some of those subspecialties to be able to provide in our comprehensive clinics. So all of these things I think are definitely a work in progress, but these are some things that we want to focus on moving forward. And then I can't remember, was that my last slide? Yep, that was it. So we're really excited about kind of where we've been and the direction that things are heading. We're super excited and so very thankful for our collaboration and partnership with the Bleeding Disorders Association of South Carolina. So thank you, Sue, and the entire team for everything that you do.
Man, I can't be more happy. You just made my day. I am so excited for South Carolina. I just think we have such great strength when we work together, figure things out. If you need any help with any of that, fundraising, whatever, I know that we can do. We can support a lot of things. So reach out anytime and we'll help in whatever way we can. But I am very excited, especially about the adult. You guys are great and I love you. But I think you just get those adults in there, if they have an adult face, then then it's just hard to say you're 50 years old, go see the pediatric doctor.
I know.
What? That doesn't make sense. I guess it does make sense. You'll get great care, but you get it done.
Yeah,
so,
yeah, exactly.
Thank you again. So I appreciate that.
Yeah, absolutely.
All right, so anybody have any questions for Dr. Ambrose? Feel free to ask. She gave a great presentation on what we've got going here. So, and when we can grow those numbers, more funding comes into the state. So, and with the RDAC, that will be the #1 thing that I will push is, our name will be there, you guys' name will be there, everybody's name will be there that takes care of our patients. So there should be no problem with that. So I'm super excited about that. So now let's travel down to the Low Country and let's hear from Dr. Shayla Bergman at MUSC Hemophilia Clinic down there and what they've got going on. So Dr. Shayla, or Dr. Bergman, are you there? Good morning.
Here. Can you guys hear me?
We hear you.
Okay. So we don't have as much going on, it sounds like, as Stephanie at the moment. We have similar, probably new referrals and new diagnoses for the year. I would say probably around 50 to 60 this past year. We are not an official HTC, although we function as one. And I am currently submitting an application for us to hopefully be accepted into the Southeastern Regional Network. So that's what I've been working on. Our division does have a designated psychologist for us now that works with us, which has been fantastic to have one that's dedicated to our division. We are in the works with collaborating with 2 of our MUSC gynecologists who are very interested in adolescent health and bleeding disorders for a multidisciplinary clinic with us when we have our hemophilia clinics, and or maybe just when with our von Willebrand's patients. So that's been very exciting to get that ball rolling. We too are having, just like Dr. Ambrose, we don't have a designated adult hematologist or provider currently, although we are heavily recruiting. And like she said, I think that's across the nation. But it would be very nice to have a person to collaborate with here. So my hopes are that hopefully that will be resolved sooner than later. I do have a handful of adult patients I follow, and then there's been several that I've sent up to Columbia or Greenville for adult HTC referral care. And really, you know, I would say for 2022 for us, my hopes are, like I said, that we're accepted into the regional network, and we get that ball rolling as a pediatric HTC. That would be fabulous. And then obviously that will help hopefully, you know, broaden our care, broaden our resources, broaden our outreach with those things. And then I think personally, what, you know, before COVID, I was really quite interested in bringing bedside ultrasound to our group, having several people trained in that. So I think now that we've kind of not completely emerged from COVID, but we have a little bit more, I guess, normalcy to some degree, I'd like to get that ball rolling for us to be able to provide that for our patients. And those are really, really where we are. You know, we're still pretty active in clinical trials. We're pretty active around the county. Obviously, we would love to do whatever we can with Sue at any time. I'm always happy to help. I think I'm going to try to probably weasel my way into that rare disease advisory council bill and see what I can do with that, because I, like you, was not quite sure that on behind the scenes. So those are my goals.
And I did in my little email say that you have Dr. Shayla should be happy. So I will try to wiggle our way in there, but I'll come and visit you when we come down for that. But any help that you need in the HTC designation, I've always said, you know, you guys are all doing that great work, and we got to get you all of you into that HTC network. So and get you recognized for the work that you do. So that'll be awesome. And we'll come visit you down in January and have a visit or whatever. And I'd love to come anytime to your clinics or whatever we can do to make sure we spread that awareness and send folks that are down there down your way and get that adult HTC, get that adult doctor. I don't know. We need to, I don't know what we need to do to get our, I know it's a national problem. Our adults are great people. I don't know. We just got to let them know that if you work with our adults, you'll be part of this community, and you guys are very special. So we'll figure that out one day together, but thank you for being here with us. So I know we're running a little bit late. We'll take a 5-minute break, but before we do that, let me go ahead and have Drew come on, because I know that he's got a shorter presentation, I believe. But Drew, let's go ahead and I asked Drew to come on. We work with Drew, and I'll let him explain who he is and what he does. But I asked him to come on and kind of talk a little bit about what it's like to work in South Carolina, because a lot of times we'll be working with people and somebody will say something and I'll say, but you have to understand South Carolina. And I have grown to love South Carolina. This is my home, but I was a native Californian. And let me tell you something, California to South Carolina is very different. And I was in Colorado in between. So I said, just kind of tell us what it's like to work within our legislation here in South Carolina. So Drew, thanks for being here with us and providing this a little bit of a glimpse of what we need to work with in South Carolina.
Well, Sue, it's always a pleasure to work with you and your group. Obviously, politics are boring, but I will go through kind of quickly about South Carolina. Very conservative state. I pulled the figures today. Out of 124 House members, 81 are Republican, 43 are Democrat. In the Senate, there's 46 senators, 40 are Republican, only 16 Democrats. Shows how conservative our state is. We will be having a special election with one senator that passed away this week. Going into that, I'll be bluntly honest. I tell Sue this in our meetings, because of our conservative nature, there have not been a lot of legislative victory for the patient advocacy community in South Carolina. With that being said, this is a wonderful year to start heavy grassroots, which y'all do such a great job doing. Every single House member is up for election this year in November of 2022, along with our governor. So this is, as Aaron said at the beginning of this, it's not that hard to do. These are approachable individuals many times. A simple phone call, letting them introducing yourself, letting them know about your cause and why you feel strong about it. Personal stories are key. Everybody kind of has a personal story. It's from the heart. They feel it. They like to know what's going on in their community. And then also in a polite way, which everybody can do eloquently, the obstacles you're facing in the community, specifically with bleeding disorders, y'all can speak to that. Your voice matters. As Aaron said, they may not get to you right then. You only have 45 seconds, a minute, but keep pounding on them. It is key. With that being said, Sue and I have been talking the last couple of months about possibly the formation of a South Carolina Patient Advocacy Coalition. There are many organizations like yours that are trying to find a voice out there. Sometimes it takes a larger group to get these type of messages through. I think there's plenty of organizations that have executive directors that are strong-willed and as talented as Sue, that we can all come together and start working on these issues that matter to patients in South Carolina. It is not the easiest thing to do, but right now we do have a possibility with H3956, which is the actual piece of legislation for the rare disease coalition. As Sue stated in the beginning, it's under a proviso, which it makes it only for 1 year. So we have from January through May, the second week in May, to get this into statute and get the governor to sign this piece of legislation, which will make it in statute and will be part of state law. This is key for many reasons. As you know, many rare diseases do not have large organizations like yourself. It is just truly a mother or a father advocating for a child or themselves. And having the Rare Disease Advisory Council allows a voice, and then more importantly, the yearly update to the legislature that they'll be able to get in front of and in both bodies speak what is going on in the rare disease community. Key is grassroots. You need to get to know your local legislator. And Sue, you do such a good job at that, but that's, calls, attending events. Y'all have a State House Day, which is key. Very basic things that can get your voice out there. The red tie is obviously well known, but y'all do such a good job. But this bill, right, if it gets moving, I think is the first of many that can get the ball rolling. But also I think there needs to be a community voice of different patient groups from the low country to the foothills all the way through. So with that being said, Sue, that was kind of my gist, is just get to know your local legislator, because they are the individuals that can help move pieces of legislation along and can talk to other individuals when there's something that they strongly believe in. They'll push it inside the body as well. So that's kind of just my spiel. Sue, is there anything else you'd like me to cover?
No, does anybody have any questions for Drew? I think you hit it spot on with the patient stories and getting to know our legislators, and that then we'll be working our campaigns and our letter writing, and it's always hard to think about that. It's a little intimidating, but what I've learned through the years is that these are just people, like Aaron had said, that are out. They're your next door neighbor. They're the guy that lives down the street from a house that we own and rent out. They're just people that are doing the jobs that many of us would like to do. So we just need to make sure they understand the concerns and stuff. And what will be, there are no adults for a lot of these rare diseases physicians. So we need to attract them to the state. Maybe at the legislative level. I just read this morning that there's like $1 billion. I don't know. There's a lot of money in the state, leftover dollars. It's like, hey, get some incentives maybe to bring some adult hematologists to the states. Maybe that'll be it. So anyway, Thank you so much for that, Drew. It's a pleasure to always work with you, and we thank you for your support a lot.
Okay.
So let's take a 5-minute break, if that's okay, just to go to the restroom or whatever and get a cup of coffee. We'll be right back. And Nathan is going to be, or Allison, actually, let's hear from Allison first really quick, because I know she has just a quick update, and then we'll get to we'll take a 5-minute break, and then we'll finish up with all of our national folks, because they have some great stuff to share. So Allison Clifford with Takeda. Hey, Allison, how are you?
Hey, everyone.
A government relations quick update of what you guys are seeing around the states, and then we'll do that. Thank you so much for being here.
Sure, thanks, Sue. I'll be quick. I know we're a little timed on the agenda, but I'm Allison Clifford. I'm on the policy and advocacy team at Takeda, and Sue asked me to say a few words about how we engage with patient organizations like Bleeding Disorder Association of South Carolina, and then a little bit about our priorities for this year going into 2022. And since Nathan and Miriam, I'm a little before them, I won't steal any thunder. I'll just kind of touch high level on those priorities, but really quick, just so you could understand, I guess, as you think about a couple of things I say, just want to share Takeda's structure and how we kind of support from a policy and advocacy perspective. So our specific team resides in public affairs, and our collective mission statement is that we partner and advocate to shape the policy environment that enhances patient outcomes through access to innovation. And for context, public affairs, we have 5 functions. We have our federal and state government affairs, our team, we have our public policy and reimbursement operations, and we work, as we refer to, above brand and support class of treatment when engaging with our stakeholders as patient organizations, coalitions, trade associations, et cetera. And we do that, we shape the policy environment, or work to shape that, where we're aligned with our priorities with our stakeholders. And it's very important for Takeda to take every opportunity to understand the concerns of patients in the context of the disease state, where you live, what the resources are available, and then we can do our part to help convey the concerns to policymakers, to help them understand the real life impact of their policies on patients. So a little bit about, and then of course, we have values and decision-making process. We always try to include that when we have an opportunity to say a few words, called PTRB, Patient Trust Reputation Business, and always putting the patient first. And I know companies say that, but we really feel that lends us really, we can bring it to life in a meaningful and tangible way for patients through education and awareness and developing relationships, building trust on our actions, and then, bringing transformational medicine to patients to help patients live a better life. So that's just a little bit about kind of Takeda and how we function. I don't want to speak for other manufacturers, but I think similarly, right, we have similar goals and missions, and maybe little different structures and resources. But as you think about us, think about those resources. We're here to try to work together. And then just really high level on the priorities, we, with regard to access to treatment and affordability, as they relate to bleeding disorder, we have 3, and I'm sure probably Nathan and Miriam will either speak to them or touch on them. So I'll just categorize them. Step therapy reform obviously has had a lot of activity. 31 states across the country have passed some form of legislation, and then accumulator adjuster program bans. And I think there'll be some news on that at the federal level that'll be shared after me. But there are 12 states plus Puerto Rico that have passed legislation, accumulator adjuster language, and then P&T committee class reviews that impact PDLs. And there are 22 states across the country that have hemophilia agents on PDL. So I won't get into real specific details because, again, I don't want to duplicate efforts if that is to follow. But just know, I know that may not be specific to South Carolina. Rare Disease Advisory Council has been a big focus, and tremendous work has been done, and that we also were hopefully supportive with regard to that. And then, we obviously are always looking and monitoring future trends. So in closing, just really appreciate the opportunity to be here. It's through meetings like this that we can, break down barriers and find common ways and alignment to really hopefully help patients have optimal clinical outcomes. So with that, thank you for your time, and back to you, Sue.
Thank you, Allison. Thanks for being such a great partner from Takeda. We really, really appreciate that. So I'm gonna let y'all go. We'll quickly get something, come back if you need to. Nathan will go. I'll let Nathan pull up his slides. We'll get prepared for him and just keep rolling. I know we're a little bit behind, but I guess I should have planned 2 hours. I knew 1.5 would probably not be enough with so much that we have to offer, but we only get together just 4 times a year. So bear with us, and thank you all for providing such fabulous information. Nathan, do you want to go ahead and pull your slides up? There you go. Perfect. All right. I'm just gonna run really fast, and when I get back, let's all do this. So thank you. Okay, if everybody's back, we'll let you get started, Nathan. I know we're running a little bit late, but I'm going to apologize, but I'm not going to apologize because there's just so much that we need to talk about, and now we've got the meat of our subjects of what's happening nationally. So, Nathan, thanks for always being here and providing us with such great information. So, welcome.
Thank you. Thank you for having me. So, I'll go through these slides pretty quickly because a few of these items have already been alluded to. But hi, everybody. If you don't know me, I'm Nathan Schaefer. I work for the National Hemophilia Foundation, and I oversee the state government relations team at NHF, and I am your designated representative to work with the state of South Carolina, which I've been very proud to do for the past, 2.5 years now. It's been a pleasure. So thank you all for taking the time on a Saturday morning to convene and talk about a number of priorities. So if you've been to Washington Days before, thank you for your participation. If you haven't, we welcome your participation in the future. This past year, we had to switch to a virtual format, but we did have over 400 people that participated virtually in Washington Days. And we talked about a number of priorities. One of them is the federal accumulator adjuster issue, which the activities at Washington Days prompted the introduction of some legislation, which I'll talk about in a little bit. But the fruits of your labor certainly have been profound. We've made a significant impact with what we were able to accomplish at Washington Days this year. Looking into next year, Sue already mentioned this, but March 1st will be our virtual training for Washington Days, and March 2nd will be our virtual congressional office visits. We'll be talking about support for the accumulator adjuster legislation, as well as federal funding for bleeding disorder programs. We are also in the process of considering the possibility of having an in-person smaller Washington Days experience at some point in mid-June. Hotel negotiations are a whole other conversation, but we're in the process of trying to figure out if we'll be able to reconvene something in person in June. Not a huge regular 500 people Washington Days, but something more intimate and a little more targeted. So stay tuned for more information on that. Jeff already explained where we are with the Stimate recall and the production of an alternative option. And I just wanted to also share this map of the country that designates where alternative has been approved. It's in all of the states that are shaded in green. So do have some work to do in South Carolina. I'm not sure exactly who to approach or what should be the target of our advocacy, but I would like to see South Carolina be added to this list of states that have approved distribution of this alternative option, which is produced by Stack Pharmacy out of Denver, Colorado. So hopefully we'll have more good news to report. As you can see, the trend across the country is that it's been approved in most states at this point. I'll just mention briefly about the Skilled Nursing Facility Hemophilia Access Act that was passed last December. It just went into effect October 1st. The thing I'll point out on this slide that is true for most of everything that we do is that we experience significant bipartisan support. We always have to work across the aisle in every kind of political persuasion. And in this campaign, it was true yet again that we can get support from Democrats, Republicans, Independents, you name it. We're a nonpartisan campaign. So that was a huge victory and something that had been percolating in the legislature for many, many years. So congrats to the community on making that happen. And I will say this, if you hear of any kind of access issue where a patient is having trouble getting their care at skilled nursing facilities, please let Sue and please let the national organization know. Any kind of anecdotes that we receive about patient experiences is very helpful to us as advocates on behalf of the community. There is now federal legislation to address the accumulator adjuster issue. And I will say yet again, you can see there is significant bipartisan support of that effort. So we were really, really pleased to see that finally be introduced. HR 5801, we do not yet have a Senate companion bill, but we are working on that. At this point, we are in the process of generating additional co-sponsors for the legislation. So if we can see any members of Congress from South Carolina be added to this list of folks who are co-sponsors, that would be incredibly helpful. This is where accumulator adjuster bills have been passed in the states. I think it was already mentioned that it's been 12 states, including Puerto Rico, that have already passed legislation. The one amendment to this list is North Carolina. North Carolina just recently passed legislation about a month ago. So I will update that when I find someone who can help me figure out how to update this graphic. I just wanted to talk briefly about the trends that we're seeing in Medicaid. The Medicaid coverage of our community now is about 30% of folks with kidney disorders are receiving their insurance through Medicaid programs. And Medicaid, compared to many other disease states, hemophilia is a large expenditure within Medicaid programs. For reasons that I know you all understand and appreciate, it's a very costly condition to treat. So states have been considering implementation of what are called preferred drug lists. So if you hear us say PDLs, that's what it stands for, preferred drug lists. They're now in place in 22 states. Thankfully, South Carolina is not yet on this list. We do not have an indication that South Carolina is going to consider a PDL, but they very likely could. And if they do, we will be in close contact with Sue and the chapter, and we will figure out opportunities for patients to provide testimony about why access to care is so incredibly important. So you're not yet on this list of 22 states that have implemented preferred drug lists, but you very well could. This is a little bit of history about when states have considered implementation of preferred drug lists. And as you can see, many of them have followed suit in recent years. And these are the states that are most recently or soon are planning to consider or reconsider a preferred drug list. And this is one thing that I want to reiterate. Your state could consider a preferred drug list, and they could put all bleeding disorder products on the preferred list, and they could go back and revisit that 3 months later, 6 months later, a year later. Oftentimes, these are considerations that they revisit on a recurring basis. So we have to stay vigilant, and we have to be mindful of the opportunity to provide experiences and testimony about why access to care is so important for our patients. These are just a couple of other recent examples of where states have went back to their preferred drug list and moved some products from preferred to non-preferred and vice versa. Again, the point is we have to stay on top of this. We have to stay vigilant. I don't yet have an indication that this is going to happen in South Carolina, but it could. And it's a real opportunity for patients to provide their perspective about why access to care is so critical. We also have produced, and we can get this to anybody on the call who is so interested. If you are, why don't you drop it in the chat and I will email it to you. But we provide Medicaid resource guides to all 50 states that explains what is the process for accessing medications through your Medicaid department. And if there's any kind of prior authorization or pre-approval that is required, what does that look like? Where can you access those forms? We provide those to all of our states. So if you are interested, if you're a provider, you're connected to your HTC, or you're just inquisitive, let me know and I'll be happy to get you a copy of the resource guide that is specific to South Carolina. I know that I went through all of that really, really quickly, and I will get, Sue has these slides. So if you want a copy or a version of them, we can make those available to you. But that's what I had to share with you all. Thank you again for letting me join you this morning.
Thank you, Nathan. And I know you have another stakeholder meeting with our partners in Virginia. So thank you for taking the time this morning, because I know you'll be doing this in the afternoon. And I am hopeful that the PDLs won't come to our state. We're pretty in touch with our pharmacy director, and I think that he would let us know, but he knows that we would be pretty upset about that. So, and we would be talking pretty loudly. So, you know, we just really don't want to see that happen. So, but thank you for keeping us aware, and everybody needs to stay on top of this, as Nathan said. So next we're going to go finish up with Marian. I know we're a little bit late, but Marian, thank you for being here with us as well. She's with Hemophilia Federation of America, and it's so nice to have you today. We worked with her so many years, and as people move up and different things, sometimes we don't get those opportunities. So it's nice to see you, Marian. Thank you for being here on Saturday.
Thank you so much for having me, Sue. It is a pleasure to be back here again, and to be last. So I will also, like Nathan, try to be really short. So I realize that it is Saturday. It is the end of the program. We have been 20 months on Zoom. So I decided to talk about two things. I figured we could all hold two things in our mind, or at least I can. So hopefully everyone knows who HFA is, and I'm Miriam Goldstein. I'm a policy director at HFA. I've been there for about 5 years, and I'm also a hemophilia mom. So two things, two of the biggest federal health policy developments that we saw over the past year. One, the Affordable Care Act survived its third and hopefully final challenge in the Supreme Court. This was really important because there are lots of key protections for people with bleeding disorders in the Affordable Care Act. Protections for people with pre-existing conditions, protections against lifetime and annual caps, protection limits on how much you have to pay any given year out of pocket. So the fact that the Affordable Care Act survived is something that we celebrated and we're watching very anxiously. And then the American Rescue Plan Act, which was enacted back in March, makes, for the first time, built on the Affordable Care Act, for the first time strengthened it. And it makes insurance more accessible and more affordable, at least temporarily. I'll touch on that again. It makes changes in how much help you get in buying insurance on the ACA marketplaces, but those changes for now are only in place in 2021 and next year, 2022. So not everything is perfect. We were glad to see those two big developments in 2021, but there's some definitely unresolved problems still on the horizon. So sticking to two, we have more than 2 million low-income Americans trapped in a coverage gap, and that includes South Carolina. These are the 12 Medicaid non-expansion states. You have a unique program in South Carolina in DHAC, and it's so good to hear that that's still going strong. But Medicaid expansion is something that we would like to see in all 50 states, and it would take care of people who don't have access to that DHAC type program. It would take care of parents who may have kids with a bleeding disorder who are covered by Medicaid, but healthy families need the parents to be healthy too. And so Medicaid expansion is something that both national organizations really want to see rolled out on a 50-state basis. And we have this ongoing problem of copay accumulator adjusters and similar health insurer tactics that are really creating big challenges on affordability and therefore access issues for patients who rely on copay assistance to be able to afford their medications. And initiatives are underway to address both of these. So broke my own rule here and decided to talk about 3 positive new federal level developments. And one of them is a repeat. Those enhanced ACA subsidies. And I just wanted to repeat it again because we're at the start of open enrollment period. So if you do not have insurance through your job, go to the ACA marketplace. If you have gone in the past and insurance was too expensive, you will be pleasantly surprised because there are more subsidies available. And I know Sue is doing phenomenal outreach about the open enrollment period. But just because that we are in that period, broke my own rule, added a third one here. Another positive federal level development is surprise medical billing protections will go into effect in 2022. So if you go to an emergency room and it turns out it is out of network, in the past, you could be hit with a whopping bill, so-called surprise medical bill, because since that facility was out of network, they could bill beyond what your contracted rate was with your health insurer, and you could find yourself on the hook for thousands of dollars. Similarly, if you did all your research, you went to an in-network facility, and yet through no fault of your own, you got treatment from an out-of-network pathologist or radiologist or someone like that, you could be hit with those surprise medical bills. Congress passed a law in December of 2020. It goes into effect in January 1, 2022, holding patients harmless. There's all kinds of complicated work to be done on the back end to figure out between the health plan and the provider what the reimbursement rate is, but patients will only have to pay out of pocket what their in-network rate would be. So that is a really welcome patient protection. There's a giant hole in this, unfortunately, which is for ground ambulance services. So you can still get a surprise medical bill for ground ambulance services, but it's still a substantial improvement in patient protection. And then the SNF, the skilled nursing facility access, Nathan spoke about that so eloquently, so I will not go into it, but those protections are now went into effect as of October 1. two positive state level developments. Again, Nathan and others talked about the copay accumulator laws that have been adopted in 7 additional states in 2021 for a total of 12. And actually, it was lovely to see your map, Nathan, because I realized all of South Carolina's neighbors have passed these protections. And, so when you go to the state legislature, you can point to that and say, look, we are surrounded by states that have taken this action. We need to do the same thing. And same thing with the RDACs, and many, many kudos to Sue and all of you for all the work you did in getting that measure passed. So as we come into the fall, HFA is actually having our virtual fly-in and week of advocacy starting on Monday. And these are going to be our asks. So one is absolutely the HR 5801, the copay accumulator protection bill. We are going to be answering that call that Nathan talked about of trying to get co-sponsors in the House. But we're also going to be asking our lawmakers to support legislation that makes these Rescue Plan Act improvements permanent. Remember, I said that the increased subsidies are only in place for 2021 and 2022. We would, so great news for people who are buying insurance for the coming year, but we want to extend that. Those enhanced subsidies have made a big difference in the rates that people pay and how many people have joined the marketplace at a time of economic upheaval due to COVID. So we want to see those enhancements continue. And we want Congress to act to close that Medicaid coverage gap in South Carolina and the other states that haven't expanded Medicaid. So as I said, our virtual fly-in is next week, and you can join your voice to the effort. When I stop sharing my slides, because I'm still terrible at Zoom, I will throw this one link into the chat. You can just click on that link. You're very familiar with phone to action because you have your own account. This is a phone to action form. And if you are so inclined, you will be connected, sending a message to your lawmakers about please support the copay accumulator protections. Please make the extend the premium subsidies. Please close the Medicaid coverage gap. And we do have a half-hour reception honoring 2 congressional champions, and that will be Tuesday night. So with that, I am going to stop sharing, and I'm going to toss the link to the phone to action. So thank you, Sue.
Thank you so much. I already did that. So I've already done my job. I know the rest of you can do it too. It's very simple and quick. And I wanted to just make one little point about when you see those bills and you see all those people, the different agencies listed on there, and you can see the ALS and all that. At our state house, our RDAC really got a lot of attention in the subcommittee when they saw that, and they spoke about if there's this many organizations, this is what I'm talking about, that alliance, if there's this many organizations that think that this is really important, maybe we, the legislation, should look into it very carefully. So I think that's what's so awesome is when we join together and we become one big advocacy organization, we can get a lot of things done. So, and thank you for bringing that attention to the lower rates for the ACA. We've been pushing a lot of people there. There's really no reason for anybody in South Carolina not to have insurance outside of that Medicaid gap that you're talking about, our older adults. So we'll keep working on that. Before we close, I know that we're 23 minutes over. I apologize for that. Thank you all for trying to be brief as you can. I knew we had a lot to do, but you did a fabulous job and gave us an overview of what we need to look at in 2022 going forward. The work that we need to do still as a coalition, those of you that are patients and advocates and all of our ambassadors, thank you so much for being here and taking this time with us this morning. Your voice is very important, as you know, and we can't do anything without all of us together.